Welcome back. In the last 2 decades, the private sector has shown such enterprise and dynamism that the public sector is seen as a drag. In hard infrastructure like power, ports, airports, telecoms and highways, public-private partnerships are the preferred mode because they bring private sector efficiency into the execution and operation of projects. Even in the realm of healthcare, there are those who say that the government must become a buyer of healthcare services rather than a provider. But there are strong reasons to suggest why the state should not outsource its responsibility. When we met Gujarat Chief Minister Narendra Modi in 2008, he could not stop extolling the Chiranjeevi Yojana program, a partnership between the government and private obstetricians to do deliveries for very poor mothers in the state. He had reason to. Between launch in January 2006 and March 2008, 176,000 deliveries were done under the scheme, says a study in the World Health Organization's bulletin. About 6% of them were caesareans, much higher than the norm of 2 or 3% for the poorest fifth of the population. Chiranjeevi Yojana won the Prime Minister's Award last year for reducing infant and maternal death.
Because of this scheme, only we lost 50 mothers and we lost, not 50 even, 35 mothers we lost. And only 700 children we lost. So we could save the life of the mothers, we could save the life of the children, and nowadays we are in first three numbers in the country. First three in the country. Where we were the last three in the country.
Under Chiranjeevi, the government pays 179,000 rupees to private obstetricians with maternity facilities for 100 deliveries, including 7 caesareans. While it has certainly made a difference, one cannot be sure by how much in the absence of accurate birth and death records. A sound assessment will have to await a census study that the Indian Institute of Management, Ahmedabad, is proposing to conduct. Researchers in Surat have found doctors turning away complicated pregnancies with the government system contrary to its purpose. They have also found private facilities clustered in urban areas. While acknowledging its virtues, policymakers do not prescribe public-private partnerships as a sole solution to India's healthcare needs.
I think government must play a dominant role in the provision of healthcare to the poor. The Indian private sector is very poorly regulated. Our ability in a situation of poor governance to be able to actually negotiate contracts with them and monitor cost and quality of care is very limited. Paradoxically, public-private partnerships may do best where public system, public provision does best.
Save for the Hogenakal waterfalls, Dharmapuri in Tamil Nadu has little to recommend it. The gushing Kaveri irrigates much of the state but ignores the district through which it enters. Only now is a project being executed to tap the river to supply drinking water to the people of this predominantly rural area. It is said to be unique because most such projects have an industrial or urban bias.
The project has been conceived from that point of view. 100% population of this district, for 30 lakhs of population, consists of 6,755 villages, 16 town panchayats and 3 municipalities. All are going to get water supply through this scheme only.
Till that happens, the people of dry Dharmapuri will have to reach deep for water that is contaminated with teeth discoloring and bone deforming fluorides. Ill health impairs economic capacity, which in turn is aggravated by social regression. Poor sanitation, child marriages, female feticide, low female literacy and high alcoholism place the district the lowest in the state in development and health indicators. Yet it was the best performing district in the state under the National Rural Health Mission last year. Immunization rates ranged from 80% of the target group for hepatitis B to 99% for the anti-TB vaccine BCG. While the number of babies born has declined, the number of hospital births has increased from a little over 60% to nearly 99%, with the share of private nursing homes declining.
Now we are able to improve the performance. That means 99% of institutional deliveries, we are able to reduce the maternal death, infant death.
A network of 259 clean and well-maintained facilities, from sub-centers to a 2-year-old medical college hospital, have helped. Motivated officials have made a difference.
Really, I feel proud to serve my people here. And, it's very easy to travel from my home to here.
The perpetually cap-sporting INR has devised 7 procedures including pregnancy tracking and early detection of complicated cases and referral to higher hospitals to align maternal deaths in the district with the state's average of less than 1 per 1,000 live births.
Initially, there is a lot of private clinics. After we are giving the good services here, they shuttered down their private clinics.
In the tribal area of Kotapatti, the head of the health center is a local boy whose parents sold their house to pay for his education. He prevailed upon the previous collector to sanction anti-Naxal funds for a 10-bed hospital. To encourage mothers to deliver in hospitals, he provides food for mothers and their companions for the duration of their stay, an innovation appreciated by the World Bank and recommended for statewide application.
During 2007 November, the World Bank team was visited to our PSC, and they are appreciate the efforts taken by the medical officer and his team to reduce the domicile delivery, especially in tribal population. So they recommended to Tamil Nadu Health System project to take over that project.
With 130 outpatients a day on average, there are complaints of cursory care, but also expressions of sympathy.
நிறைய டைம் போயிருக்கிறோம், நல்லா பாக்குறாங்க. முன்ன இருந்த டாக்டர் கூட இப்ப இருக்கிற ஒரு ராஜா நல்லா பாக்குறாரு.
நல்ல திருப்தியா இருக்கு சார். எங்க ஹாஸ்பிட்டல் பொறுத்த வரைக்கும் நல்ல திருப்தி. காரணம் இவர் இங்கேயே படிச்சு இங்கேயே டாக்டர் ஆனவருங்க. லோக்கல் டாக்டர் ஆனவர். பெரும்பாலும் படிச்சுட்டு எல்லாமே டவுனுக்கு தான் போக விரும்புவாங்க டாக்டர் ஆனவட்டி. அவர் இங்கேயே பிராக்டிஸ் பண்ணணும், நாம இங்க படிச்ச ஸ்கூல்ல அப்படின்றதுக்காக பிராக்டிஸ் பண்ணிட்டு இருக்காரு. அவரால் உள்ளூர் டாக்டர் ஆகிறதுனால எல்லாருக்குமே நல்லபடியாக கவனிச்சு சாட்டிஸ் பண்றாரு.
For Collector P. Amuda, who has been on a job for 32 months, education and healthcare are priorities. She takes maternal mortality very seriously because it can render children destitute and a burden on society if the father remarries.
We have a maternal death autopsy meeting which happens once in 2 months, which I myself chair. So in these meetings, if any maternal death happens in a private clinic, the doctor who conducts delivery has to be here. In fact, there's someone to be here to explain why this death happened. Because a life is a life, whether the death happens in a PHC or in a private nursing home. So they also have to maintain high standards and do not take any poor patient or anybody in a negligent way.
DMK ministers, whether Telecom Minister Andi Muthu Raja or former Highways Minister T.R. Balu, do not score high on governance at the centre. Yet Tamil Nadu's administrative culture does not allow corruption to undermine the delivery of public services, whether it is a DMK dispensation or AIADMK. The state's Medical Supplies Corporation has set the standards for transparency and efficiency since 1996, making quality drugs readily available to the poor. That only a few states are now copying this tried and tested model indicates the hold of special interest groups on the country's public healthcare system.
I don't think, therefore, it's a lack of knowledge. I don't think, therefore, it's a lack of capacity. Somewhere, this is where governance really comes in. You have to take the hard decision to do the right thing.
For the nation's healthcare administrators like Amarjit Sinha, Tamil Nadu holds a mirror to what a well-run public healthcare system can achieve. The state has separate directorates for medical and public health services with their own budgets and staff. The other states merged the two after the 1950s to the neglect of disease prevention. By keeping them separate, Tamil Nadu has done much better than the national average on indicators like infant mortality, maternal mortality and fertility control, though there has been a slight let-up in immunization. The National Rural Health Mission, launched in 2006 at the Prime Minister's behest, has reversed the neglect of public health care. Government spending has increased from 0.84% of GDP to 1.1%. About 700,000 community health workers have been recruited. Over 100,000 doctors, specialists and nurses have been appointed. A huge number of health facilities have been built or repaired. There is a lot of emphasis on flexibility and innovation at the local level. Unfortunately, the poorly governed states are the ones that are the worst performing, though there are exceptions like Chhattisgarh and Bihar.
So overall, we feel happy that yes, the public system, people have voted with their feet, and there are examples, state like Bihar, where the average monthly attendance in a PHC was 39 patients. Last 3.5 years, it's been in the range of 3,000 to 4,000 patients a month.
We began this episode with a comparison with China. In the realm of healthcare, this much can be said, that India can advance by learning from China's past. Thanks for watching.